Good morning, everyone. HCMA is pleased to welcome you to this DSCSA Overview, customized for pharmacist members of NCPA, the National Community Pharmacists Association. My name is Liz Gallina. HCMA is pleased to continue our commitment as an association to bring up-to-date education on the implementation of this important federal law that affects all members of the healthcare supply chain. This webinar is for information and educational purposes only. Just a reminder that HCMA does not endorse any particular proprietary solutions and that only HCMA staff represents the association's positions on particular issues. Please note that today's webinar is being recorded. All participant lines will remain muted during this broadcast. This is a 60-minute program. The full recording, replay, and presentation slides will be made available on HCMA's website after the webinar by Friday afternoon. For Q&A, you are encouraged to use the Q&A feature to ask questions at any point during the event, and we will also have a more formal Q&A session after the presentation. Type your question into the Q&A box on the lower right side of your screen, and then click on the Send button. I would also like to thank our sponsor for today's webinar, TraceLink. TraceLink protects patients, enables health, and ensures compliance for companies across the global life sciences supply network. Businesses use the TraceLink Life Sciences Cloud, the Amazon AWS-based cloud application platform, to deliver global connectivity, visibility, and traceability of pharmaceuticals from ingredient to patient. One connection links the company to over 100,000 entities on the network, supporting DSCSA compliance, global serialization preparedness, and end-to-end track and trace readiness for the largest pharmaceutical company or the smallest pharmacy, clinic, or hospital. TraceLink also provides resources to pharmacies, including educational content related specifically to the DSCSA law requirements and its impact on pharmacy dispensers. I would now like to introduce our speakers. Anita Duca is the Senior Vice President of Regulatory Affairs at HCMA. She serves as the Chief Liaison and Advocate on behalf of HCMA with federal regulatory agencies, including FDA, DEA, and CMS. She has been with the association since 2002. Also joining us today is Susan Pilch. Susan is the Vice President of Policy and Regulatory Affairs for the National Community Pharmacists Association. Prior to this position, she worked as a multi-state lobbyist representing primary wholesale pharmaceutical distributors, as well as served as Director of State Legislative and Regulatory Advocacy for another health-related professional association. With that, I turn it over to Susan and Anita.
Okay, thank you. This is Susan. I'd like to just start off by giving just a little bit of an overview as to how the program and some of the things that we're going to cover in this morning's session. First, we're going to have an overview of the law itself. We're going to be covering what pharmacists need to know, kind of front and center, what we need to know coming up, implementation timelines, things going down the road, and then at the end we will have some question and answers. So I'm going to start off today with an overview of the Drug Quality and Security Act. This was signed into law on November 27th, 2013, and there are really two sections of this law. The first one is actually drug compounding, and that's obviously something that we're not going to be covering today. And actually, it's interesting, in the pharmacy community, the compounding side of things really received a lot more attention than the other drug supply chain security, which is what we're going to be covering today. So essentially, the Drug Supply Chain Security Act establishes a national system for tracing drug products through the supply chain, and we'll get into that a little bit further in terms of the exchange of information that's going to be in place. And it sets national standards or licensing standards for wholesale distributors and third-party logistics providers, or 3PL. And it also preempts existing state licensing and pedigree requirements. Some of you might be in a state that have or had, I must say, state pedigree requirements, kind of that would provide sort of a passport for drugs that move kind of outside the normal chain of distribution. And I do want to comment that the Drug Supply Chain Security Act portion of the law is really kind of apportioned out into two phases. We are going to be focusing today on the phase one, the most immediate, which really focuses on the exchange of certain types of information as products are moved through the supply chain. Now, throughout phase one, manufacturers are going to be starting the process of serializing all drug products. And so the phase two, which we really do not get to until 2023, and that has yet to be fleshed out, there are going to be additional requirements that are going to require players in the supply chain to make additional use of that serialized information. And I'll get into a little bit further on that as to some protections we were able to get in the law for independent pharmacists. So a lot of people in the pharmacy community were kind of tasked with a lot of different issues, have asked, you know, where did this come from? What was the impetus behind this supply chain legislation? And I already mentioned that a lot of states, or you might have been familiar with your state having a pedigree system, and that number was increasingly growing, and all of the systems were different. Also, there was the looming implementation, 2015 implementation of a California, what was called the e-pedigree law. Now, this law kind of went above and beyond any other existing state pedigree law that would have required electronic tracking and tracing of all drug product packages now in real time, and this is the sort of stereotypical or would have been thought of as the track and trace where you scan every single product that goes in. So at each chain or each link in the chain would have had to scan each individual item, and this document or e-pedigree would have continued to grow with each distribution. So at the end of the day, pharmacists would have been stuck or would have been responsible for maintaining and being able to access massive amounts of data, and the cost of compliance with that was estimated to be extremely high. And so in addition, there were, you know, the FDA has always been interested in this issue. They first proposed a system sort of like this in 2007. And there was sort of the understanding that the FDA was looking at the California law as sort of a national template, that there was some concern among all players in the supply chain that this was going to sort of spread and be really unworkable for everybody in the supply chain. There were some initial estimates that a couple of NCPA and I believe NACDS did with sort of the cost of compliance, which estimated the cost for each individual pharmacy at $100,000 in the first year alone. And sort of where we got to the sort of text of this individual law is there was an industry coalition formed, which was made up of brand and generic manufacturers, all of the wholesalers, and various pharmacy organizations to try to come up with a federal solution, for lack of a better word, that would kind of preempt the California law and all other state laws that would be somewhat more workable.
Okay, this is Anita. I'm going to start by explaining the three foundational elements of the DSCSA. The first is traceability, and this is what we're going to spend most of our time on today. The DSCSA establishes a phased national system for tracing pharmaceutical products through the supply chain. But there are also two other elements you should be aware of. One is licensing. The states may still issue the licenses, but now there will be a uniform national licensing standards for wholesale distributors and third-party logistics providers. And then the third is preemption. The DSCSA immediately preempted all state laws and regulations for tracing products through the supply chain, which you probably know of this as pedigree requirements. And it also preempted state laws and regulations regarding wholesale distributor and 3PL licensure. On this slide, we have a timeline that shows the 10-year progression towards the DSCSA's ultimate goal, which is an interoperable electronic tracing of product at the package level. This shows key deadlines and stepping stones for you and your trading partners as they approach unit-level traceability in 2023. We'll go over the key milestones for dispensers in a moment. However, the DSCSA also deliberately attempted to firm up the linkages between trading partners, so the definitions and responsibilities for others in the supply chain may also affect dispensers, and many of those key deadlines are also shown in this timeline. So since we wanted to provide you with a more comprehensive explanation of what is going on, we'll be discussing some of these deadlines and your trading partners as we continue today's webinar.
So to start things off again, so this law applies to products, which are prescription drugs in finished dosage form for human use. So to clarify, this does not apply to OTC, devices, API, or animal drugs. And there are some classes or sort of types of drugs that are exempted from the definition of product. And these are listed on your slide here, including blood and blood components intended for transfusion, radioactive drugs and radioactive biologics, imaging drugs, intravenous, medical gases, homeopathic, and compounded drugs are exempted from this as well. So to move along, and this is a really important slide because, especially for dispensers, because there are the ability or the traceability requirements apply to transactions or changes in ownership. But there are a couple of transfers that are really important to dispensers that are exempted from this definition. One is a transfer of a product from one pharmacy to another, and this does not have to be between affiliated pharmacies to fill a prescription for an identified patient. So there is an identified patient there. Distribution of minimal quantities of products by a pharmacy to a licensed practitioner for office use. And then the third one here is another one that's really important, particularly for independents, is distribution of product pursuant to a sale or merger of a pharmacy. And so that's also really important. And we combination products, some of these are otherwise known as kits, and for emergency medical reasons. So in case of, natural disaster or some other things in which typical systems kind of break down, that pharmacists are allowed to do this without having to comply with this transfer requirements. Okay, so what do dispensers need to know? And this immediately. So we need to talk about what is product tracing, typically what types of information are going to be being exchanged, what are you going to be receiving from your upstream partners, and then what are your responsibilities for any downstream movement that may occur. What are the dispenser's responsibilities and when do they take effect? And third, what questions should they ask of trading partners? And we'll get into this a little bit further as we go along, but particularly, for your independents, what do you need to ask, particularly those in the upstream in the supply chain from you in terms of how you'll be receiving the information from your trading partners and other arrangements that could be available to you.
Okay, this is Anita again. Let's talk a little bit more about exactly what product tracing is. This refers to the phased approach that the DSCSA adopts for requiring manufacturers, wholesale distributors, dispensers, and repackagers to pass, capture, and maintain certain information with respect to each transaction. The product tracing requirements are triggered by transactions which change ownership between trading partners. To give you a little more detail, the information that is being transmitted involves three distinct data elements related to the transaction. The first is transaction information, or TI, which includes the name of the product, the strength and dosage form, NDC, container size, name and address of the seller and the purchaser, and there's additional information specified in the DSCSA. The transaction history, or TH, is the paper or electronic statement that includes the transaction information for each prior transaction back to the manufacturer. Then we have the transaction statement, or TS, and this is a paper or electronic attestation by the entity transferring the ownership of the product that it is authorized under the Act, it received the product from an authorized party, and again, there's more DSCSA defined information that must be included. In other words, there is a statement that goes with it that it is a legitimate business and it is not knowingly handling an inappropriate product. Essentially, each business must provide the TI, TH, and TS to the subsequent owner for each transaction. And then it must also capture and maintain for 6 years the data for each transaction, whether as the buyer or as the seller. This requirement began on January 1st of this year for manufacturers, wholesale distributors, and repackagers. It will begin on July 1 for dispensers, such as yourself, and wholesale distributors will typically provide the data to their dispensers. But if there's a drop shipment, the manufacturer or other supplier the wholesale distributor orders from will be providing you with the data. This slide has a graph that depicts visually how this product tracing is intended to occur. If you look at the graph, you'll see the large icons there in the middle. The first on the left represents the manufacturer, the second the wholesale distributor, and the third the dispenser. And along with the movement of the ownership, where you see the lines, the arrows, I should say, between each of the supply chain partners, you'll see underneath those arrows a small icon that indicates the product, and the second small icon indicates the data, and the third the ownership. So as ownership moves, so will the product and the data. And so you can see there it moves from the manufacturer, the product, the data, and the ownership to the distributor, and then from the distributor to the dispenser, the product, the data, and the ownership. Now, the exact requirements for providing each of these data elements will vary for different business models and buyers and sellers. And this is probably your most typical business model. So we want to show you another one that is a little bit more complex. And in this instance, the sales and the data and the product are going to move from the manufacturer to the first distributor, which we call distributor X in this graph, then from distributor X to distributor Y in this graph, and then from distributor Y to the dispenser. As you can see, each time there is product and ownership movement, the data must also be provided to the subsequent purchaser. These graphs were based upon 13 different business models that HDMA analyzed and put together in what we call our transaction scenarios guidelines. We will, at the end of this program, we're going to give you a link to our resources, and you'll be able to access our website and obtain these guidelines. They show, again, the 13 different business models, plus also the data and how the data does vary from business model to business model, but you'll be able to see that if you wish.
Okay, so now this is Susan again. I'm going to kind of switch gears a little bit. As also part of this law, you know, we really try to, or the authors try to build upon what currently happens in pharmacies today when pharmacists encounter something that does not look correct, the label seems off, the pill is not the same shape or the same color. And, you know, what happens in pharmacy practice today is typically the pharmacist removes that, checks with their trading partners, calls around, removes it from stock. And really the law just seeks to try to standardize that in some way. Now, the law really kind of instructs pharmacists to put together their own sort of process to deal with these sorts of products that might be counterfeit or otherwise unfit for consumption. Interestingly, the law, technically this is a part of or effective on January 1st, so if you have not started doing this, start thinking about any way you might want to kind of standardize your current operations. But the FDA has not issued any final guidance on this either, so we're kind of in a gray area right now. But anyway, just be thinking about sort of standardizing how you deal with these types of situations. Also, the FDA has also issued a couple of other tips or articles out there for pharmacists, kind of cautioning them to, make sure you know the source of your drug, be careful for offers that seem too good to be true, pay close attention to the label for things that are slightly off. And so actually, when we get to the next slide, we'll talk a little bit further about this. So under the law, they define suspect product as a reason to believe that it's potentially counterfeit, diverted, stolen, or otherwise unfit, or illegitimate product. Credible evidence shows that basically the same thing. And basically just what we kind of talked about. It's sort of vague, but, it sort of relies on the pharmacist's professional judgment to make a judgment call about whether what does not seem appropriate, out of the ordinary, what requires some due diligence. Now, as part of the information exchange that I know Anita kind of covered, that's certain types of information. Also, under the law, you have to maintain that for not less than 6 years. And before independents start getting worried about how this is all going to play out, we will get to that about some other ways in which you can rely on some of your trading partners to help you with that. But also, sort of, how this is going to come up is really the only time you're going to be asked for any details on kind of the products you may have received is really when an FDA or a federal or a state government official, regulatory official might come to you and ask in terms of, we received a report from out in the supply chain that says there might have been a counterfeit entered into the system at this date and this location. Can you please go back and check your records? And that's how that's kind of going to play out. And so we talked a little bit about authorized trading partner, and I mentioned that a little bit in terms of the FDA's admonition out to pharmacists to kind of know your partners, know who you're doing business with. And basically, authorized trading partners really kind of boils down to a licensed entity, both in terms of wholesaler, 3PL, and dispenser.
This is Anita again. The DSCSA also provides other definitions that we thought it would be important to make you aware of, and that includes, of course, the dispenser definition. And these are a retail pharmacy, hospital pharmacy, group of chain pharmacies under common ownership and control that do not act as a wholesale distributor or any other person authorized by law to dispense or administer prescription drugs, and the affiliated warehouses or distribution centers of such entities under common ownership or control that do not act as a wholesale distributor. Wholesale distributors also have a specific definition, and a wholesale distributor is a person other than a manufacturer, manufacturer's co-licensed partner, a third-party logistics provider, or repackager engaging in wholesale distribution as defined under the DSCSA and the Food, Drug, and Cosmetic Act. And the wholesale distribution is considered to be distribution of a prescription product to anyone other than the patient.
Okay, and so critical dates for dispenser compliance. Now, when technically dispensers are supposed to be receiving and storing this type of information that they're going to be receiving from their upstream partners, it kicks in on July 1st. And it's at that date when you are going to be kind of responsible for having that and having access to that. And like I mentioned earlier, there is a 6-year record retention. And I think most importantly, probably I know for the independents, is this last particular bullet point is the third-party agreement. The language of the law itself allows for a third party to be able to kind of keep track of this information that they're going to be receiving from their upstream partners for them. And I mean, I think at this point in time, probably the wholesaler is probably the most logical party at this point in time, but it allows the wholesale distributor to sort of maintain this transaction data to be captured and stored by the pharmacy. Now, keep in mind that the law does not require the wholesaler to do this on behalf of a pharmacy, and it will require a written agreement between pharmacy and wholesalers. So if you have not talked about this issue with your wholesaler or heard about it from your wholesaler or wholesalers, please do so today or immediately to try to see how this is going to play out, to try to talk to your wholesaler in terms of how they plan on getting the information to you, how are they able to maintain the information for you, and how will that play out. Now, we have heard that some wholesalers, and I think probably the primary, a lot of the major wholesalers, are creating web portal systems for dispensers to access the relevant information. And I know at least a couple of these are going to be tied into sort of the pharmacist ordering system. So we'll keep record of basically what you ordered on what day, so that if you are kind of asked by a regulator, you are able to go in easily and look up that day on what you received on what day from your wholesaler. And just as sort of a distinction, just note that the difference between access to information and storage. So those are two key components that you need to talk to your wholesaler. And I do want to mention that not just your primary wholesalers you need to talk to. If you deal with any secondary wholesalers, please reach out to them that you currently do business with or you plan to do business with to see how that is going to play out with those parties.
Okay, we knew that return products might also be of interest to you and how the DSCSA handles those. The statute also has a directive for them, but they're slightly different, but not incompatible for dispensers versus wholesale distributors. A dispenser may return product to the trading partner from which the dispenser obtained the product without providing the TITH and TS data. A wholesale distributor may accept the returned product, but that is pursuant to the terms and conditions of an agreement between the parties. And finally, we'll just note that there are some changes in the returns requirements coming up in 2019. We'll mention those briefly in a moment. FDA was very aware that there were technical challenges with providing the data, and since the original deadline was January 1st, and noted that they were still having some substantial challenges with that, they issued late in the year what they call their product tracing requirements compliance policy. So they, in recognition of these challenges and that many supply chain members needed additional time beyond January 1st, they wanted to avoid potential disruptions in the provision of prescription drugs. So they indicated that they do not intend to take action against trading partners who do not, prior to May 1st, 2015, provide or capture the product tracing information. We believe that by using the term intend, FDA was leaving the door open to take action. For example, if they saw some truly egregious non-compliance, they weren't closing the door on any kind of action that they would potentially take. I also wanted to emphasize that the policy, while very, very helpful and everyone appreciated FDA's recognition, it applies solely to the data requirements that were intended to go into effect on January 1st. It does not apply to any other DSCSA deadlines or any other DSCSA regulated entities or requirements. So it's very helpful, but it's also got a very specific definition as to who it applies to.
Okay, so this graph or chart kind of tells you about some key dispenser milestones. And just January 1st, as we mentioned, it kind of officially kicked off. This is when manufacturers are starting to kind of send out the information from their offices or their facilities down to the wholesalers. And this is kicks off the process where everyone's trying to get a handle on how this is all going to work. At the same time, I don't know if any dispensers out there may start getting information from their wholesalers. Like I said, they're not technically on the hook or responsible for that information until July, but you might start seeing that. Also, as we previously mentioned, you need to start thinking about how, or standardizing how you currently deal with those products that do not seem quite right to you, and try to think about sort of how you plan to have that going forward. As Anita said, you know, the wholesalers there is enforcement discretion for the wholesalers keeping track of that right now. And as you know, the dispensers are going to be on the hook on July 1st. There has been some question as to whether there's going to be a corresponding enforcement discretion for the information for dispensers. At this point in time, we have not heard that is on the table. However, that's always a possibility. This is always meant to be a phased-in type of approach, so we will definitely keep you posted if there anything changes with that. But at this point in time, just keep in mind that July 1st is still the date at which those requirements do kick in for you. Now, moving on down further in the year, we see kind of another list of other topics. And included in the law, there are quite broad provisions that allow anyone in the supply chain, basically, to ask for a waiver, exception, or exemption from really any part of the law. And as I said earlier, we are also awaiting some other final guidances on some really kind of key topics, quite frankly. So we're kind of, everyone in the supply chain is kind of watching and waiting to see how that is all going to play out. But these are just some things to keep in mind at this point in time.
Okay. We thought you should also be aware of some of the longer-term deadlines. This is moving out. They're not immediate, but they will be coming up in the next few years. In 2017, manufacturers must affix a product identifier to each individual package or homogeneous case. Repackagers must do the same thing, but they have until 2018 to affix the product identifier. In 2019, wholesale distributors must only accept products that contain the required product identifier, and they are also required to verify the product identifier before redistributing returned saleable products. In 2020, dispensers must only accept products that contain the required product identifier, and then at 2023, we get to unit-level traceability.
Okay, so just the need to know for independent community pharmacy. As we mentioned before, when you're going to have to be responsible for kind of keeping track or being able to access and storing the information you get from your upstream partners, it's still July 1st. And I know I'm sounding like a broken record at this point, but run, do not walk, and ask your wholesaler and wholesalers, both primary and secondary, about how they plan to be getting the information to you and about any capabilities they might have in assisting you with accessing and storing the information. Also, at this point in time, as I mentioned, the law mentions third-party assistance. Now, probably at this point in time, this is probably not an option, but moving forward, you know, I know a lot of independents work with technology vendors. They have a tech vendor that they work with very closely. You might want to also talk to your tech vendor to see how they, in the future, could help you, assist you to integrate this information into your current systems that you already have in your pharmacy. So that is definitely worth doing. I do know that NCPA has been dialoguing with the groups of tech vendors that typically serve independents, so we have teed that up for them, so they should be aware of that. As I mentioned earlier, FDA is just sending out warnings to pharmacists on knowing your sources. Be aware of, you know, unsolicited offers that might seem too good to be true, names of wholesalers that you've never heard of before, things that just do not seem quite right. Just be careful about that. And as I mentioned also, although, you know, technically the requirement is there for putting together a process for these suspect products, there is no FDA guidance on this to date. So kind of do your own best efforts at this point in time, and as soon as that kind of hits, we will definitely make that available to you. Also at this point, I do also want to mention that we haven't really talked about phase 2 at all in this, and that really wasn't the point of this webinar, but just know that, you know, as we get to phase 2, the serialized data, there's an expectation that there's going to be additional usage of that data. And I do want to mention for independent pharmacies that NCPA was able to secure some significant protections for small dispensers in phase 2, which is basically a small dispenser is defined as 25 or fewer full-time employees. And basically, before any phase 2 requirements can go into effect, the HHS secretary has to contract with a private independent consulting firm to conduct a technology and software assessment that looks at the feasibility of small dispensers conducting interoperable electronic tracing of products at the package level. And it will look at whether there is hardware and software readily accessible and whether or not it can be integrated into existing business practices and is not prohibitively expensive. So this gave us a bit of comfort moving forward with this language being included in the law, and I did just want to highlight that for you.
Okay, I just wanted to mention a little bit about what might be the potential penalties associated with failing to comply. There is a requirement called a prohibited act under the Food, Drug, and Cosmetic Act that might be applicable if there is failure to comply. The commission of a prohibited act could subject a party to an injunction of unlawful activity, seizure of goods, or civil and criminal fines and penalties, and that might even include jail time. We also would note that it might involve state penalties, and this is going to be on a state-by-state basis depending on that state's laws. For example, a state law might reference the Food, Drug, and Cosmetic Act. So it also depends on how the state incorporates this particular statute in its own laws. So I wanted to give you a final recommendation for the questions for your wholesale distributor. We've emphasized several times it's really important to get to your wholesale distributor and have a dialogue with them about how they're going to be providing the data. And we wanted to give you some general questions we thought that might start that dialogue so you could have them to help you out. First of all, please ask them how they're going to be providing the data. Is it going to be, for example, in a portal? Is it going to be on paper? Is it going to be electronically in an advance ship notice? You would also want to ask them if they will hold the data for you, and if they do so, for how long. And you might also want to ask them what data will they be providing and for which products. This may vary product by product depending on who their own supplier is. You will want to discuss with them how you'll know if the data are correct when you receive them. And we would also encourage you to ask about sample data before July the 1st so that you can verify the transmission method, get comfortable with it, understand what is going on there. So that wraps up this section of the webinar, and I'm going to turn it back to Liz to talk about Q's and A's.
Thank you, Susan and Anita. We would now like to take some time to answer any questions you may have. Remember, you can use the Q&A feature in the WebEx located on the bottom right-hand side of your screen. We're going to start. We already have some questions coming in. I will start with the first one that we received, which was, as a closed-door long-term care pharmacy, what information, if any, do I need to provide the long-term care facility? The law doesn't specifically address long-term care facilities or closed-door pharmacies, but under the definitions, the pharmacy likely would be a dispenser and has to receive the transaction information, transaction history, and transaction statement from their wholesaler. If there is no change in ownership when they are sending those products to the long-term care facility, then they likely may not have to pass those data elements, but they still do have to keep the records for 6 years as well as adhere to the suspect and illegitimate products. But I would recommend, based on your individual business structure and how you are set up, as well as the relationship with the long-term care facilities, I would recommend that you consult your outside counsel or internal legal folks just to make sure and confirm that what you're doing is in compliance. Moving on to our second question, we wanted to, I think the question was to have Susan repeat the information about the small dispensers.
Yeah, and I know there was a question about what exactly, could I repeat that, and it's defined as 25 or fewer full-time employees, and maybe what the question was getting at is what is defined as a full-time employee. And actually, I don't know that that's necessarily addressed in the law. It probably is going to dovetail with what I believe is what's defined as a full-time employee under the Affordable Care Act, but that's probably something that would warrant a greater investigation, but that is my guess on that.
Also, Susan, can you elaborate on the Phase 2 requirements?
Sure. Sorry, let me repeat that again. We were able to get protections for those small dispensers. So before anything that can be required of small dispensers in any kind of Phase 2, the HHS Secretary has to contract with a private independent consulting firm to conduct a technology and software assessment that looks at the feasibility of small dispensers conducting interoperable electronic tracing of products at the package level. And I must say that the part of the law, actually written into the law, the consulting firm must agree to actually consult with small dispensers. And so this assessment has to look at whether there is the existence of hardware and software that's accessible to the small dispenser and can be integrated into existing business practices, and whether or not it is prohibitively or not prohibitively expensive. And then finally, the Secretary, if it finds that this is not available or a feasible option for small dispensers, the Secretary shall prescribe an alternative method of compliance and also a waiver process. And so that's basically the protections for small pharmacies in Phase 2.
Okay, the next question that we have coming in is, does the transaction information, history, and statement information required to be maintained in July include traceability to the specific lot and expiration date for the product purchase?
Yeah, Liz, I'll quickly handle that. Yes, you must keep whatever data the wholesale distributor provides. There's no requirement for expiration date, but the requirement for lot number is going to vary somewhat depending on what the supplier that you purchased from, where they are in the supply chain, whether they were, for example, a direct purchaser from the manufacturer or not a direct purchaser from the manufacturer. So there's going to be some variability in that. I would suggest, again, that you take a look at the HDMA transaction scenarios, because it will list out for each of these types of transactions what data you should be provided to you. So I'm going to refer you to that for more specifics on when that occurs. But yes, you must keep the data that is being provided to you.
Great, thanks, Anita. One other question that came in, I think for Susan, was whether programs like the Match RX program for pharmacies would fall into any of the exemptions that we talked about.
Okay, thank you, Liz. And actually, as it works out right now, that particular program does not under current law, although I can tell you that this is something that we are talking to the FDA about it. Because we know those types of programs really work to kind of alleviate shortages, and there are a lot of protections built into that system. So that is definitely something we are dialoguing with the FDA about that right now. One of the other questions had to do with bulk chemicals. We mentioned that the compounds were exempt, and yes, the bulk chemicals are exempt as well.
We've had a couple questions also just about whether the slides will be available, and again, as a reminder, they will be available as well as a recording of the presentation of this program that should be on our website by the end of the week.
And also that will be on the NCPA website as well.
Susan, I just wanted to ask one other question, just to clarify. I know that you talked a couple of times about the processes that dispensers should have for suspect and illegitimate products. How is this different from what they're doing today?
And it really isn't. It really is just sort of more of a recognition to sort of just kind of memorialize that process that already takes place now. And, you know, the FDA realizes that, you know, like I said, and we've heard from multiple pharmacists, that typically, you know, something comes through their pharmacy, the label doesn't look right, the pills do not seem, they're off, something is wrong with it. You know, pharmacists typically in today's practice remove that from stock, call their wholesaler, might call the actual manufacturer and say, look, I have this product, is this one of your products? It may or may not contact the state board in your state. And sort of these are the same types of things that pharmacists already do. So in terms of setting up or talking about a process for your pharmacy, it might just be helpful for you to just sort of memorialize, like, you know, if product is identified, we will quarantine that product or place that in a specific portion of the pharmacy. And then in terms of contacting your supply chain partners, I mean, it could be as easy as that in terms of that's your process. And that's really all they're getting at here.
Great, thank you. The next question we have is, are we required to keep this information on products we dispense to customers, or are we only required to keep the information that concerns our store and our wholesaler, whether it's receiving or returning products? Anita, did you want to take that one? Or?
Well, the DSCSA does not require you to provide the data to your customers. So you're off the hook for doing that. The data you must keep is the information that does concern that you receive from your wholesaler, and again, the data, whether it is receiving or returning products, again, back to the same wholesaler you purchased it from. So you don't have to worry about what you are dispensing to your customers. That was recognized as not being a necessary part of this.
Great, thank you. The next question that we have is, has any guidance been issued for expired medications processed through a drug return company to remove from the pharmacy's inventory? And I assume this is for essentially when you have expired product that is non-saleable going to a reverse distributor or returns processor. My understanding that under the DSCSA, returns processor or reverse distributor is actually defined as an entity that processes or takes for disposition or destruction expired or unsaleable products. It is my understanding that you do not have to pass TITHTS or documentation, so it would likely be whatever you are normally keeping in your records, whether it's for inventory, et cetera, that would be the same process that you would follow under the new requirements.
So the next question is, the pharmacist in charge, I need to have an SOP for this process written down and formalized versus today where it's just good practice. And yes, exactly. It does not need to be particularly extensive. It's just so that you have a standard process in place. And as I said, you know, that the FDA has not issued any type of formalized guidance on this. So whatever you feel in your professional opinion to be appropriate, that will be fine. And it says, who are some third parties that could store the information outside of supply chain partners, if any? And I mentioned just a little bit about tech vendors. Like I said, I do not know of any that are gotten into this space as of yet, but I do know that, you know, moving forward, these are entities that possibly might be willing to do this, possibly be able to kind of integrate it into your pharmacy system. So you might want to tee this up with your tech vendor to see if they're aware of it or whether or not they are planning on getting into this space.
One other thing you might want to do is talk to your wholesaler, including, finding out how they're sending you that information, but also they may have recommendations for other vendors or other ways that you can do that as well.
It says, if another independent pharmacy needs to purchase a product to dispense to one of their customers from our pharmacy, what are the requirements for both parties? Well, I mentioned that there is an exemption. If there's an identified patient, that is an exemption from the passing of the information requirement. So as long as there's an identified patient, you do not have to worry about that. That's kind of basically the same as dispensing, but you don't have to worry about that information going down.
I might add that you would want to check out what the law specifically says and how it defines wholesale distribution, because if you are practicing that and it meets the definition of wholesale distribution, you would follow those directives that accompany that. So it depends on your specific circumstance and what you're doing, and we'd advise talking to your legal counsel as well for how you're handling those business practices.
Okay, great. Well, without further ado, we'll start to wrap things up. This has been very valuable in terms of your presentations and the information for dispensers. If you haven't begun yet in terms of preparing for DSA, we urge that you start as soon as possible. The DSCSA is extremely complex, and it contains much more than what we've had time to cover today. Requirements vary based on individual business models, product purchasing and handling practices, and other factors depending on how you're structured and who your trading partners are. We urge you to review the DSCSA and consult with your own legal counsel and other advisors as you move through implementation.
You might also want to take a look at the traceability resources. We have included on the page that you see here, NCPA's website, HDMA's, and FDAs for further information. And as I said, we have put out a lot of guidances for wholesale distributors, and although they're specific to wholesale distributors, there are a lot of items there that we think that dispensers and others might also find useful.
We also want to thank TraceLink again for sponsoring today's webinar. TraceLink has a resource section on their website geared particularly for pharmacies, which you may find useful. The TraceLink page is a set of various educational content related specifically to the law and its impact on pharmacy dispensers. We've also provided Susan's contact information for further outreach, and also a quick reminder as well for HCMA's Traceability Seminar scheduled for mid-October here in Arlington. That is an annual program that HCMA puts on and talks really strictly about traceability and implementation of DSCSA. Thank you for your time today. Please feel free to contact HCMA or NCPA with any additional questions that you might have. And thank you again to Susan and Anita. As you are exiting the webinar, you'll be asked a few brief questions. The survey should automatically appear in your browser window, and we very much appreciate your feedback. Thank you for participating, and this concludes today's webinar.